Ending Medical Reversal. Improving Outcomes, Saving Lives. Vinayak K. Prasad, MD, MPH. Adam S. Cifu, MD. Text copyright 2015, Johns Hopkins University Press. All rights reserved. For more information about our books, go to press.jhu.edu. Introduction. This book is about how, despite tremendous advances in the clinical, genomic, and surgical sciences, doctors continue to use medical practices, sometimes for decades, that are later shown to be of no benefit to their patients. Over the past 6 years we have researched and struggled with this topic, which we call medical reversal, and in this book we share some of our conclusions. For those who follow the medical news, the simple fact that medical recommendations change will come as no surprise. Time and again, we see enthusiasm for some medical therapy. Beta-carotene, vitamin E, low-fat diets. Rise and fall. First there is certainty that a new practice will help extend your life, then there is equal certainty that it does not. To people outside of medicine, as well as many inside the field, this process is frustrating. When you look at the day-to-day recommendations that doctors make, the ones that usually do not make the news, you find the story is similar. In 1 decade, doctors recommend an aggressive treatment of high-dose chemotherapy and stem cell transplantation for women with breast cancer, promising that it will give a woman her best chance of a cure. Then, over the next decade, doctors report that all of that enthusiasm was misguided. The aggressive treatment was no better than a less aggressive course of therapy, which, incidentally, was what we had been doing previously. Many people dismiss this phenomenon as the natural course of science. Of course, hypotheses turn out to be wrong, and we can only move forward through trial and error. Although this is certainly true in biomedical science, where there are false starts, good hypotheses that fail to live up to expectations, it is not the case in medicine. Medicine is the application of science. When a scientific theory is disproved, it should happen in a lab, or in the equivalent place in clinical science, the controlled clinical trial. It should not be disproved in the world of clinical medicine, where millions of people may have already been exposed to an ineffective, or perhaps even harmful treatment. In this book, we hope to make the case that when it comes to how we care for people, medicine can do a better job of recommending practices that actually work. In the long run, more and more of what doctors do can be enduring. False starts are inevitable in science, but not when we apply science to caring for people. History.
Sample complete. Ready to continue?